Great day, everyone. Hope you're doing well out there. And to start off, I just want to say thank you. Last week we ran our reactivation program, and we had a great turnout, a great job of former patients that have been gone for. Had one patient who was gone for a year or over a year and came back in, and there's others not that long, but they came back in, and it's just the importance of taking good care of your health, realizing where health comes from, realizing, hey, it's our responsibility to take care of ourselves. So I want to say thank you. It's my pleasure and my honor to help this community get healthy and stay healthy. And that's the big part. A lot of folks miss the follow through with staying healthy. And that leads us right into our topic today, wellness care. Wellness care. Why? There's a misunderstanding among in the in the public versus chiropractic care, and the misunderstanding is you got to keep going back. And when I was in school, I'd hear that, and I was, I do hear that. You know what I'm saying? I do hear that outside noise saying, hey, you got to keep going back. And in saying that, I'm like, yeah, why wouldn't you? What gets you healthy keeps you healthy. It's that simple. And I'm big on analogies here, so here's an analogy for you. And this is real life about me. I'm telling myself here. I exercise. I talk about exercise, but since Christmas, I haven't exercised regularly. I just haven't had the time, as a matter of fact, with life going on, and so I haven't exercised regularly in the last 2 months since Christmas, right? So exercise that I would do, say 6 months ago, that was easy for me, or not as challenging. I did it last week. I was like, man, I was huffing and puffing, So I realized then, hey, I got to keep it up. I've been exercising, but not consistently. And so that's why you say way about your spine. You have to keep the subluxations from getting worse. Yes. It's kind of like the cavity in your teeth, right? We know about dentistry, right? We know how you go to the dentist, look for cavities. And if you have one, you got to do something about it. Because if you don't, what happens to the cavity? It keeps getting worse. Same way with the subluxations. Now, I haven't covered this topic in a few months or even years, so I'll cover it down about the subluxation, even what caused the subluxation. The 3 T's. And you're like, well, what is that? Trauma. We all know about, hey, the falls we had, the accidents we had. Now that affected our spine or our whole body. How is it? It was just sore, hurting, or whatever. I got hit in the neck, and this nerve coming out here was going all down the arm. Got it. We remember that, right? But what about trauma that's micro trauma, like the way we sleep, the way we stand, the way we sit, our working posture, whatever it may be, those are micro traumas that just reinforce the subluxation, And hopefully you're not asking what a subluxation is, so I'll cover that here too now. A subluxation is a bone out of place that puts pressure on the nerves. And those happen commonly. Those happen without even knowing sometimes. You know about the trauma that, I felt that, got that. But what about the way you stand all day, and now 2 days later from standing at an event, whatever it may be, my low back sore. That was a subluxation. It didn't get your attention then, but it is today. So we have to take good care of ourselves, have to maintain ourselves. And we call it wellness care here. But back to the 3 T's. We have the trauma. We have the thoughts. And Lord knows we're all under a bunch of stress and a bunch of thoughts that just aren't very productive for us. So trauma, thoughts, and toxins is the third one. And if you pay attention to anything that's been going on in the news or the world today, is, hey, the air is polluted, the foods we eat are sometimes not very healthy, and even the water we drink can have toxins in them too. So those are the things that cause the subluxation. And that's the reason for the wellness care. Now, wellness care, that's just like your tune-up care, your maintenance care. Just keeping the body coordinated, keeping the body functioning the best that it can. So, we had a reactivation event last week. We talked about how good it was, and we want to thank you for that. But now, I want to help you understand the reasoning for the wellness care. I know I remember I've been in school and you hear about this, and you hear the public say things sometimes about, you got to keep going back to the chiropractor. Yeah, you do. You keep going back to your dentist. You keep going back to your mechanic. You know what I'm saying? We do things to help us be the best that we can be. So your car helps you be the best you can be because it gets you from here to there and things you want to do, right? You want to keep your car healthy. Your dentist helps you with your smile. Helps keep it bright and shiny so you don't have cavities and teeth falling out. And your chiropractor wants to make sure your central nervous system is healthy. Make sure your spine is healthy. Because we talked about the subluxation, how important it is to correct those. And once you got a crisis care, you kind of forget how that was. Doc, I got this pain right here in my neck and it's shooting down this arm over here. You remember that. But when it's not happening, we kind of forget that. But guess what? If you don't keep it up, if you don't keep what got you healthy, if you don't keep that up, guess what happened again? It can come back. Because we talk about the teeth and the cavity, the subluxation is very similar. The subluxation, it goes into degenerative disc disease. And sure, most folks have some degree of that. Most. I haven't, it's not age dependent. It's not trauma dependent. Most folks have some kind of degeneration of the spine, degenerative disc disease. And it starts with the subluxation. It starts with dis-ease. It starts with the body not functioning properly. Back to pain shooting in your arm here. Say there was no traumatic event, but a few years ago I felt my neck hurt a little bit, but it got better. Thankfully, it got better. And then it came back. It's been coming off and on, but now I got the pain down my arm, and that has really got my attention. I hear these things sometimes in the office, and it's just people don't know what to do about it. It's what I'm talking to you now about, keeping the body healthy. And once you get healthy, then you got to keep it healthy. So just know that life happens, thankfully, right? But what are you going to do about it? But let's say you already passed that point. You want to know about it now. Like, Dr. Jones, I'm hurt now. What can I do? Hey, please, if that's you, go to our website and westpointfamilychiropractic.com, and in the space provided next to my picture, which says Learn How, put your email address in there. I'm then going to send you specific information on how to help you overcome your injury without drugs and without surgery. So those are the two important things that we do here. We don't necessarily want to treat you with drugs. We definitely want to keep you out of surgery. Okay, so just know, website, Learn How, put your email address in there. I'm going to send you information. But if you're already a patient and you're coming in, just want to encourage you about the wellness care, about, another term for it is maintenance care. But I like wellness care, just sounds better. I'm being well, That's something that, people ask how you doing. I'm doing well. You know what I'm saying? I want to do well. I want to be well, do well, and I want to help the community be well. So thank you for your time today. I'm Dr. Britton Jones, West Point Family Chiropractic, and it's our pleasure helping you stay healthy. It's our honor helping you maintain your active lifestyle. Something that we love hearing from you. Oh, I can do this now, or I'm doing this more now, So So I just want to thank you for that. So, if you're one that needs help with their health, hey, go to our website, westpointfamilychiropractic.com, and in the space provided next to my picture where it says learn how, put your email address in there. Or if it's not you, it's someone that you know, share this. Let them know how we can, or let them know that we can help them. Not to say how, we don't know how yet, but let them know that we can help them. And then if you just want to come see us, 1106 3rd Avenue, West Point, Georgia. If you want to give us a call, please feel free. 706-645-1033. Those are the best ways to contact us. You can reach out to us on the whatever platform you see these videos on, but the best way is one of those first three. Email, website, call, or come by and see us. So, Dr. Brenton Jones, West Point Family Chiropractic. I appreciate you. It's my honor and my gratitude to help this community become healthier, become happier, because Lord knows we all want a healthy and happy community. Be blessed. I'm Dr. Brenton Jones, and I will see you real soon.